Mr. Lloyd, do you believe that a woman's constitutional right to abortion depends on her immigration status?
I think any entrant into the United States.
It's a yes or no question, Mr. Lloyd. Do you believe that a woman's constitutional right to abortion depends on her immigration status, yes or no?
A number of rights.
That is not a yes or no question. That is not a yes or no answer, Mr. Lloyd.
My answer is that any number of rights depend on where they stand in terms of our immigration system.
I do not understand that answer. Is that a yes or a no? I'll take that as a no. So, do you believe that immigrants have constitutional rights?
Once again, ma'am, if somebody wants to come into the United States and
I'll take that as a no. Mr. Lloyd, do you have medical training of any kind?
If I need advice regarding any medical situation regarding any of the populations I serve, I consult the medical team.
So the answer is no, you don't have medical training of any kind. No, I don't. Are you trained to provide counseling services to young people, Mr. Lloyd?
Again, if counseling services are called for, then I rely on the team of counseling professionals to advise me in my role as director.
So, Mr. Lloyd, what expertise makes you qualified in this Jane Doe case to override the determination of a Texas state court that Jane Doe is mature and competent enough to make her own decision?
I'm not going to comment on any individual case, but in any case that comes across my desk, we're going to look at the totality of circumstances that may affect their case. And that may include legal, it may include policy considerations, medical, social welfare considerations, and we have a team of experts and staff who are well equipped to advise me on any number of those things. And in terms of what outcomes we're going to come to or what decisions we're going to make, it's going to come from a totality of that advice and the facts on the ground.
And Mr. Lloyd, is anybody able to review or override your decision, or are you the ultimate decision maker with regards to a woman's ability to exercise her constitutional right to abortion?
The Office of Refugee Resettlement is situated within the Department of Health and Human Services, Administration for Children and Families. And so I answer to the Assistant Secretary for Children and Families and to the Secretary of Health and Human Services.
Mr. Lloyd, is it your intent to block unaccompanied minors from accessing abortion care, or will you instruct providers to deny minors other types of reproductive health care like contraception or information on contraceptive methods? How far is your jurisdiction over this issue going to extend?
Again, any time or any circumstance is going to depend on the totality of facts that any individual case brings before us. And so it's always going to be a case-by-case determination.
It's extremely troubling to me, Mr. Lloyd, what's happening. I think you're far overreaching over your expertise or your jurisdiction. Mr. Henshaw, from the beginning, America has been a refuge for the persecuted, and in keeping with our values, past Republican and Democratic presidents alike have championed refugees and regarded the refugee program as core to the nation's identity. And in fact, 20 national security leaders, including Henry Kissinger, Michael Chertoff, Madeleine Albright, wrote in a 2015 letter, and I'm quoting, that resettlement initiatives help advance U.S. national security interests by supporting the stability of our allies and partners that are struggling to host large numbers of refugees. And yet, this administration has repeatedly and contrary to evidence characterized refugees as frauds, security threats, and resource drains. To what extent and why do you think that this administration's view of refugees is so dramatically different from the long-standing bipartisan tradition and fundamental American values?
Security is our utmost concern with any refugee program. And we have, over the years, often reevaluated our program to make sure that the best security standards are met, and that's what we're doing now. I believe that the current plan to bring in up to 45,000 refugees this year is well within our our past history of refugee numbers, and signifies that we are still the leader in refugee resettlement in the United States, in the world, sorry.
Mr. Chairman, I ask unanimous consent for one more short question. Thank you so much. Mr. Henshaw, the White House's recently released statement of immigration principles cited a misleading study claiming to show that United States can resettle 12 refugees in safe zones near their home countries for the cost of resettling one refugee domestically. Are you aware of who performed that study?
No, I'm not. I would just simply say that it is always our number one option to resettle people voluntarily back in the country from which they fled.
Let me just say, and I'll yield back my time, that the source was the Center for Immigration Studies, an organization that the Southern Poverty Law Center has designated as a hate group and found that it disseminated white nationalist content on over 2,000 occasions. Deeply disturbed that the administration would be using that as a source of anything in an official report. I yield back, Mr. Chairman. I thank you for the additional time.